Hi all, I'm Bincy here. After a long back, I'm back with Gynae here, okay? Gynecology. So today we are going to deal about pelvic tuberculosis. See, you know what is tuberculosis, what is the causative agent of tuberculosis and all, right? So what is pelvic tuberculosis? We'll just lead in this video. Fine. So pelvic tuberculosis is a rare and often difficult to diagnose and treat. Okay, pelvic tuberculosis in fact on the fallopian tube, which occurs due to the bacteria causing infection. Now, the bacteria which is causing pelvic tuberculosis is Mycobacterium tuberculosis. I hope you all remember. The bottle of entry of Mycobacterium tuberculosis is through lungs. Okay. Now, the pelvic tuberculosis or tuberculosis of the genitourinary tract, everything is secondary. So the first primary infection will be on the lungs. From that, the Mycobacterium tuberculosis or the bacteria that will be spreading, or it will be affecting the other organs also. Like that, it is a secondary infection, not the primary infection. Okay, so the lungs are the most common organ that is involved, and also GU tract. The route of entry of the microorganism or the bacteria is through lungs. Fine. Now, what are the etiology? We already said it is Mycobacterium tuberculosis, nothing other than that. Okay, then smoking also we say, but it can be considered as a risk factor, but exact is Mycobacterium tuberculosis. Now, what are the clinical manifestations that are dealing up with pelvic tuberculosis? Is like the first one will be asymptomatic. Asymptomatic. The pelvic pain, fever, menstrual disturbances like dysuria, amenorrhea. Okay, not dysuria, dysmenorrhea, amenorrhea. Okay, amenorrhea means absence of a menstrual cycle. Dysmenorrhea means difficulty in the menstrual cycle. That means pain and all will be there. Then vaginal discharge, that is leukochoria. Okay, sometimes ascites. Ascites is like fluid accumulation in the abdomen. Okay, then fallopian tube which transports the egg from the ovaries get inflamed. Due to that, it get blocked and ends up in infertility. Now I have to teach you anatomy and physiology, I think so. See, fallopian tube, okay, which end up with fibrae and the ovaries on both the side, right? So now the ovum which is matured, it will be circulating, or it will be coming through the fallopian tubes and meeting up in the isthmus junction, ilium isthmus junction. If in that junction, if the this one sperm is not waiting, there won't be any fertility. Okay, that's the usual process, you all know that. So what happens is, like, once the ovum is not being able to travel, and because of that, if because this pelvic tuberculosis, because of this, the fallopian tube is getting affected. Okay, there is an infection and inflammation occurring in the fallopian tube. Because of that, the ovaries are not able to travel from the ovum is not able to travel from the ovary. Okay, from the ovary, the ovum is not able to travel to the uterus because the root is blocked. Okay, because of it is blocked due to infection and inflammation, so that the ovum will be stuck there, and from there only it get degenerated. Okay, it won't come to the uterus, and there won't be fertilization occurring. That can lead to infertility. I hope you all understood. Then, moving on to the diagnostic evaluation, which is for pelvic tuberculosis, history collection, physical examination will be done, Montax test will be done. Okay, then biopsy, laparoscopy. Okay, that is endometrial biopsy and laparoscopy will be done. Okay, then the management, very effective treatment is like anti-tuberculin therapy, or we can say DOT and all. You all know, no, in tuberculosis you have been learned it. Medicines are very effective in killing the bacteria. Treatment continues from 6 to 9 months. That is, anti-tuberculin drugs will be given from 6 to 9 months. Then intensive therapy, that is intensive therapy will be given for 4 drug at a time will be given for the patient for continuing for 2 months. Okay, and then by 3 drugs for 4 months. That means now 4 drugs at a time will be given to continue for 2 months. Okay, then 3 drugs, that means the 1 drug they will be removing it off, because that course is only for 2 months, and again the 3 months 3 drugs which will be given for followed for other, okay, other 4 months. Okay, like 4 to 6 months, 6 to 9 months treatment continues. Now, however, drugs cannot repair the damage done by the tuberculosis or mycobacterium tubercle on the pelvis, because the rupture of the fallopian tubes and all will not be repaired with the drugs and all. Okay, for that surgery might be written, or we can put a tube, that is fallopian tube catheterization. Fallopian tube catheterization, what does it do is like the blocked fallopian, or where the inflammation and infection occurred in the fallopian tube, there the tube will be cannulated, and because of that infertility that cause will not be occurring. Okay, for that we use this fallopian tube catheterization. I hope you understood this. I'll just brush up easily. Pelvic tuberculosis is a secondary infection which is affecting by mycobacterium tuberculosis. The portal of entry is through lungs. It's a rare condition and it's very difficult to diagnose. It's also so the etiology, we said it's a mycobacterium tuberculosis. Clinical manifestation mainly is asymptomatic, but it can also have pelvic pain, fever, menstrual disturbances such as dysmenorrhea, amenorrhea, okay, vaginal discharge, that is leukochoria, okay, sometimes ascites. Ascites is nothing other than fluid accumulation in the stomach. Then fallopian tube gets blocked because of inflammation. Because of that, infertility can also be a cause or a clinical manifestation. The diagnostic evaluation, mainly Montag test will be done. Then treatment of management is anti-tuberculin drug, that is drugs will be given, and that is for 6 to 9 months. The first 2 months 4 drugs will be given. Okay, later the next other 3 drugs will be given for continuing for 4 months. Okay, first one is for 2 months, next one is for 4 months. Okay, then however the drugs will not repair the damage which was done by the mycobacterium tuberculin to the fallopian tube, that such as rupture, inflammation and all of the fallopian tube. Because of that, infertility is also ending up as a clinical manifestation, right? For that we will be doing fallopian tube cannulation or catheterization, okay, to end up or to have fertility or fertilization provided. Okay, I hope you all understood. Thanks and have a nice day. Thank you.